I'll start by reading the item so that folks at home know what we're voting on. Agreement between Dauphin County Prison Judicial Center and Work Release and Mediko Incorporated provide health care services in the amount of $13,493,529. And I just want to say that I was one of the 2 votes in favor of Mediko to handle the healthcare at Dauphin County Prison. In the spirit of transparency, I want to advise that I did not receive the final contract until after the agenda came out yesterday. And it's also been brought to my attention from the solicitor that another item came forth this morning. So I'm just stating that for the record.
Prior to discussion, if we could have a motion and a second.
Based upon that, and without belaboring the point, I would make a motion to table.
Second.
Okay, we have a motion to table from Commissioner Hartwick and a second from Commissioner Pries. I will provide discussion on that. I think it is a very bad idea to table this item, given the urgent need that we have in this transition. Late last year, Prime Care pulled the rug out from under us. They are supposed to be under contract through the end of this year, and they put us in a position to put an RFP out, forcing a rush procurement process. This board selected Mediko under a challenging timeline. Why did we select them? Because we had an expert consultant advise us. They haven't gone bankrupt multiple times like many of the other people who applied. They haven't had judgments against them. They have an excellent track record. For the last few weeks, our solicitor's office has worked incredibly hard to, I think we're on contract version number 9 of what has gone back and forth between himself and Mediko's legal. We've ensured between prison administration and my office to ensure that Mediko has had meetings with all the necessary entities that they've needed to meet with, including human services, including all the other departments that are part of this transition to ensure that they're informed of our processes. The reference that you make to an item we are all looped in on, and that is the DA's office, because our booking center does blood draws, and that will need to be worked out as an addendum. And that has already been discussed with the GA. That's in process. We didn't want to allow that to hold up this contract. We're working it out as an addendum. I understand that this is a significant increase financially. It's a massive increase financially. It was going to be a massive increase financially no matter who we went with. When we put out an apples to apples FTE sheet to just see, that's full-time employee sheet, to see what everyone was spec'd at, it was clear that Mediko is cheaper than Prime Care. And with what we have now, I believe we do not have time. Like yesterday at our prison town hall, we heard from correction officers who are feeling the weight of an October 1 deadline. They're feeling the anxiety of not knowing what it's going to be like to interact with new nurses, what the new protocols are going to be, what the new processes are going to be. And I feel there's a great urgency before us, but I also feel like we've had a lot of time to consider this. Every week in our executive sessions, Mr. Owens has provided updates on where we're at on the contract, on the discussions. This isn't a surprise that this is up for a vote. We knew October 1, this transition was going to happen. We also knew it was going to be expensive. But do you know what's really expensive? Lawsuits, legal costs, which we've been paying for so long in this county, as just accepting that that is the price of healthcare. Accepting that that is just how this industry is run. That's what's going to happen. You're going to pay lawsuits. Settlements, we're going to have to pay the families for millions of dollars. And you know what's incredibly heartbreaking? Is the worst tragedy of all of it is the deaths. Not the money. The families that I've met with, that I've sat with, that I've even held while they cried because their family member passed away in Dauphin County Prison due to a lack of adequate care. And so yes, I passionately support this, even though it is an increased expense. And I believe we've had plenty of time to consider this. We've had multiple proposals before us for months now. I don't think tabling this is a good idea, but that is the motion before us, and I will allow my colleagues to share.
I have a question. I said I haven't seen the addendum or what was added today, but you said everyone has seen it. Have you seen
No,
it?
the addendum will be voted on later by the Board of Commissioners. Is that correct, Mr. Allen? Just want to make sure that you're understanding.
That is correct.
Well, as one commissioner in the, again, pushing for full transparency, I would like the time to review the final contract. I supported Mediko. I'm the reason you're here with the second vote. But I'm not going to vote on a $13.5 million contract without reviewing the final contract.
If I could ask a question. When did I see the contract for Mediko for the very first time? When was it presented to us?
I don't have an answer.
Yesterday, I saw a contract for the very first time following an executive session. This is like Groundhog Day. There are so many times where I heard individuals on this board talk about transparency. Now, you're expecting us to vote on a $13.5 million contract with multiple layers of concern. And I don't want to bring this debate up because we can talk about it next week, and hopefully we're going to talk about costs, containment, and claims processing, and prescription drug containment. Like, there's so much to this contract, and you give me less than 24 hours, and then you're going to say that somehow other people might have a whiteboard up saying you're corrupt. You're not transparent. You're absolutely corrupt because you didn't give time for commissioners to review in the process. I saw a contract less than 24 hours ago, and I'm telling you I want the opportunity to review that contract. I don't know why when other people don't do and have processes you feel included in, that there is a corruption allegation, but yet simply the ability to ask for dialogue and information to be able to make adequate decisions, now this has to be rushed and we need to take your word for it.
No, that's fine. I received that criticism. I think the only difference that I would state is that we selected Mediko. That was the decision that was of this board. Our solicitor has brought us updates at every executive session. We've had opportunities. He's told you we're in the middle of contract negotiations, even outlining that. Should there have been better communication? Sure. But I will not concede that this is a surprise to anybody. Whereas in my case, when I was bringing up corruption, it was always a surprise. I found out that we were even working with a particular vendor 24 hours before I voted on it.
I would hope that Mediko would be happy that all three commissioners want to review the contract, and that all three commissioners are comfortable with a $13.5 million expenditure on healthcare at the prison,
No question.
which is probably going to be almost a 50% increase from last year.
We have a motion and a
With,
second.
I might add, no way to pay for it.
No way to pay for it.
We have a motion and a second on the floor. Is there any further discussion? Hearing none, all those in favor of tabling item 10?
Aye.
Opposed? Aye. Motion carries.